In March, China confirmed that for the first time, the H7N9 strain of bird flu had been transmitted to a human being. H7N9 has been called one of the most lethal influenza viruses we have seen so far. In the past, the Chinese government's withholding of information has arguably made situations worse. This time, it is actively collaborating with international organizations. We look at the repeated outbreaks of disease in Asia and discuss international cooperation on this issue.
Welcome to Asian Voices. I'm Aiko Doden. How can we prevent a pandemic? Today our topic concerns what information we can glean from the recent spread of bird flu in China and what that information means with regards to future developments. We will also look at survey results released by China in April and discuss them with our three expert guests. From Beijing, we are joined by Dr. George Gao, Deputy Director General of the Chinese Center for Disease Control and Prevention and Professor at the Beijing Institute of Life Science, Chinese Academy of Sciences. He is also Chief Scientist for a task force on H7N9 studies and is coordinating research for both China and international collaborations. And from Manila, we have Mr. Timothy O'Leary, Public Information Officer at the World Health Organization Regional Office for the Western Pacific. He communicates information, including on the recent spread of bird flu in China, to the world. And in our Tokyo studio, we have Dr. Kentaro Iwata of the Kobe University Graduate School of Medicine. He is an expert on infectious diseases and has experience with clinical care in China. He also has extensive first-hand experience with everything from new strains of influenza to SARS, severe acute respiratory syndrome, and has been closely watching the H7N9 case. Thank you all for joining us today. Thank you.
Thank you.
My first question is to you, Dr. Gao. The H7N9 virus was confirmed to have been transmitted to human beings for the first time this March in China. And since then, as of May the 7th, 132 confirmed cases and 31 deaths have been reported by Beijing to WHO. Now, it seems the number of cases has largely flattened, but could it be on its way to truly being contained? Now, what is your assessment?
So it seems the effective measures we implanted for this H7N9 in China, it works. So you look at the numbers, the number is going down. It tells us, so it truly works, and also maybe because the weather is getting hotter and because also the weather makes some difference. So obviously the measures implanted works, and so far, what I should say, we can see this H7N9 outbreak is well controlled or maintained in China.
Let me go on to Mr. O'Leary. Dr. Gao says it is on its way to being contained. Now, what is WHO's point of view? The WHO has described the virus as one of the most lethal in existence. Now, how close are we to a pandemic situation, or is it fair to say H7N9 is a serious danger to mankind? What is WHO's assessment?
Well, first, the first thing I would like to say is to basically compliment the Chinese authorities for the response to the outbreak. The response was timely, it was quick, it was very professional, showed a lot of strong leadership and a very high level of commitment. WHO has been, like the Chinese authorities, has been taking this outbreak seriously from the very beginning. And certainly the disease is serious to the more than 130 people who've been infected and the 31 people who have died. On the other hand, what else do we see? Well, we see so far no human-to-human transmission of the virus. And we see that the virus transmits very inefficiently to human beings. So and also the virus has been contained to a region of eastern China, and we are not in a pandemic situation. The virus has not gone global the way H7N9 influenza did in 2009. So while we take it very seriously, we are not in a pandemic situation, and we feel that the Chinese authorities have done a very good job managing the situation with their international partners.
Thank you. No, I will be asking Dr. Gao with regards to the reaction from the Chinese government, but my question to Dr. Iwata is that you have experience on the infectious diseases, and at this point the source of the infection has not been conclusively determined. It has been said that the people might be infected through contact with poultry, but we also know that around 20% of the infected people did not actually come into close contact with poultry. Now, what can we make of these findings?
Well, when we think of infectious diseases, there must be a source of infection all the time. So there are two possibilities I can think of. The first is that there might be some unknown source of infection which has not been identified yet. The second possibility is that the recollection problem. People might not remember all the contact with any potential source of infections, which happens to the other infections as well. So far, I think Chinese CDC as well as WHO has examined lots of animals and the human possibilities and has not identified any other source of infections. That is not to say that there is none, but I think so far we probably have these two possibilities, and I think we cannot really decide on which and which. But the bottom line is, like some rumor says, I think there's no human-to-human transmission, which explains these 20% of the no-contact with poultry.
I see. So, but we can say that we don't exactly know the entire picture as of yet.
Well, it is often the case. For example, HIV infection, which causes AIDS, we exactly know the source of infection, but still some patients don't recall the potential contact with the source of infection. So it is sometimes impossible to tell the entire figure of the contact.
I see. No, Dr. Gao, earlier Mr. O'Leary gave credit to the response by the Chinese government with regards to efforts to contain this bird flu. But when we recall what happened in early 2000, from November 2002 to July 2003, the respiratory disease SARS infected more than 8,000 people and caused around 800 deaths. And some people believe that casualties were greater because of the Chinese government's delay in publishing critical information. But this time, under the direction of Xi Jinping's administration, we have heard that the Chinese government responded rapidly, which Mr. O'Leary gave credit to. Now, what exactly has changed under the new administration?
I think somehow you're right, and I appreciate Dr. O'Leary's comments. So Chinese government takes this outbreak or infection very seriously. And under Mr. Xi's leadership, as you might heard, when he visited somewhere and he said something about making the empty talk harms the nation. And you have to take the real action to survive the nation. So after the H7N9 occurs in China, and the government takes this very, very seriously, Vice Premier Liu Yandong, Madam Liu Yandong, and she visited China CDC immediately and to push the work very hard. And Madam Li Bing, who is the new commissioner for the Commission for Health and Family Planning under the new government, and when he's forward, second day in the work in the commission, and she visited China CDC. And Mr. Li, our premier, and also visited China CDC. and he turned this internal meeting as an open meeting, and Dr. Michael O'Leary from WHO was invited for this meeting. So obviously, this case, Chinese government take it seriously and also share the information with the international organization. We also get some help from international organizations, and also we share the data with the scientists. So that's very, very important to maintain this outbreak. More importantly, you can see, so this government under Mr. Xi's leadership is responsible, like he said, responsible for history and for the people. So what I would give a comment, I still remember when I learned English, I remember Abraham Lincoln's Gettysburg address, said something about this government is of the people, for the people, and by the people. So far, from the treatment of this outbreak, it works very well, I hope. So this government will work very hard, so hopefully this containment will effectively control this outbreak.
Right. But Dr. Gao, if I could ask you another question. China is a large nation, and maybe not all are covered by health insurance, and thus some afflicted people may not seek medical care. Some researchers actually believe that we do not know for sure the full extent of the recent situation. What does the Chinese government need to do to prevent the spread of this new virus? What do you think is the challenge faced by the Chinese government?
So you are right. China is so large, but to China CDC, and in my mind, every single life, and it's very, very important. So I don't think from the current situation or current statistic data, we might miss some cases. Because although, if you go anywhere in the world, maybe someone is not covered by Medicare insurance. However, you remember, in China, that's the China government. From time to time, we always implement some urgent measures. For example, in this case, the Chinese government claimed anyone who infected with H7N9 will be covered by so-called critical illness insurance program. So we also have some basic medical care insurance system here. So you might be, someone might say, someone might miss this program. But generally speaking, because all these measures have been implanted, I do think, anyone can be missed this program or, cannot be covered by this Medicare program.
So, Dr. Gao, if I could follow up, you are saying that the Chinese government is making sure that the cost does not become the issue or the excuse for the possible potential patients to go and visit the doctors.
Yes, that's correct.
Dr. Iwata, you were in New York, of course, as a doctor, but also in Beijing when SARS was ravaging China.
Yeah.
You were treating patients at the hospital. At that time, what was it that you experienced and that you felt through events
Well,
firsthand?
honestly, I was very, very scared. I was working at one of the international clinic in Beijing as a family physician, and I saw a number of people with fever. At that time, anybody in Beijing who had fever was categorized as either probable or possible SARS. So I was scared because I could get infected with a mortality of 10% disease, which was scary. Also, another fear I had was to send a patient wrongly to the so-called SARS hospital so that they could get unwanted SARS virus, which was not necessary. The infectious diseases could be diagnosed later on, and you don't know which kind of virus or any other bacteria they have at front when you see the patient. it is completely unknown. So it is looking back, you will know that this patient had a SARS or H7N9, but the frontline doctors won't know, and that is very scary.
And what about the problem of access to information, the accurate information?
Well, it was in 2003, and there was no development of social network at that time like what we have now. So there was some shortage of information, and we had rumors and the fears, and we had a struggle to getting to accurate information at the time.
I see, and providing information becomes crucial in these cases.
Absolutely.
And that is precisely what Mr. O'Leary is doing. And WHO actually has a Twitter which I follow, actually. Mr. O'Leary, the reason bird flu has caused such concern is because of the possibility that this new type of influenza, one that could spread from person to person, could appear. What is the likelihood of such a new strain of flu appearing as a result of a genetic mutation in the current H7N9 virus? And how serious is the threat of such a virus coming into being, do you think?
Right. Well, the most important thing to stress right now is that this virus, the H7N9 influenza, there's no evidence yet of human-to-human transmission. And of course, that's kind of the nightmare scenario, because with human-to-human transmission, especially efficient human-to-human transmission of the virus, then you might be in a pandemic situation. We are not there yet. And a lot of very smart people are working overtime to do everything possible to ensure that we don't get there. Now, what are the chances? Well, Dr. Gao, Professor Gao and Dr. Iwata are scientists, and they can probably tell you much better than I can. But I understand influenza viruses to be highly mutable, highly changeable. And of course, one of the serious concerns is that this virus could somehow adapt or evolve again to develop the capability to so that human beings could transfer the virus to each other. We don't want that to happen. It hasn't happened yet, and we hope very much that it won't. And we're doing everything we can to stop that from happening.
And Mr. O'Leary, there certainly is the possibility, maybe not too distant in the future, that a new variety of flu could appear somewhere in the world. Tell us about the WHO's strategy to contain a pandemic caused by such a virus.
Sure, thank you. Well, one of the things that's different now from 2003, around the time of SARS, it's that the rules, the international rules governing countries' behavior when there is a disease outbreak, these rules have been tightened under what are called the International Health Regulations of 2005. And basically what these rules say is countries have to say what they know when there's a disease outbreak, period, full stop. And I must say, this is what China did. China began to suspect that there was a new disease at work in China. It gathered the evidence, and then it told as it must under the international health regulations. And then you can also point to the situation in Saudi Arabia, for example, with the coronavirus. Following the exact same international health regulations, Saudi Arabia has done the same thing. So, these international health regulations are one of our first and best defenses against future pandemics. Also, I must say WHO has through its Asia-Pacific strategy against emerging diseases, works very closely with countries like China to develop their capacity when there is a disease outbreak. And China has shown that its investment in preparedness, in surveillance, is really paying big dividends now during this present public health event.
I see. So, international collaboration becomes crucial because the virus can move much faster than governments.
Exactly. Exactly. It's not just a national problem, it's an international problem. We all have a stake in addressing this virus for the overall good of mankind.
Right. Dr. Gao, Mr. O'Leary has talked in depth about the situation in China. To prevent such a virus from spreading worldwide, what sort of strategies are needed at the national level, do you think?
I think first we need to keep doing the surveillance, cover as much as possible for the different kind of subtypes. For example, we are talking about the potential pandemics derived from any avian flu. For example, H5N9, H7N2, H7N3, H9N2. We never ever talk anything about H7N9. So looks like everything is possible. So for the virus comes from nature. So we have, for our surveillance, nationally, we should cover all the subtypes. And secondly, from this outbreak, H7N9, there's evidence, direct evidence. The virus comes from the chickens, especially from live free market. So we should implement the measures to close down the free market. And thirdly, so all those data from this we learn, so we must share the data internationally, and in China or anywhere in the whole world. Any new virus comes up, we should share the data. So this is very important.
Right, right. One small question to you, my final question to you, Dr. Gao. There is this impression that the lethal bird flu and swine flu often occur in Asia, especially around China. Are there any reasons to explain this, perhaps?
I think maybe at least there are two reasons. I don't think this really stands, but if you want to see that, there's at least two reasons. First, because of domestic pig raising and also domestic poultry raising, the practice in China and in Southeast Asia is something special. And also because of migratory birds, this is the field I'm working on. So obviously the migratory birds will carry some avian flu virus. They got a chance to mix with the domestic birds virus. So that gives you a chance to have some new viruses. But however, you have to remember the swine 209 pandemic virus come from Mexico. So you look at the 8 flyaways for all the migratory birds in the whole world. So look at the birds distribution. So the birds distribute, especially during the summer. They will stay in the summer in the Southeast Asia. So this is another reason.
Right, right. And Dr. Iwata,
Yes.
to wrap up our program, I would like to hear your view. As we have discussed, the source of H7N9 virus has not been determined. And why is it difficult to get the full picture? And if it remains unconfirmed, how do we fight this ongoing challenge?
Okay, well, we, as a scientist, we have to try to find out all the facts. But at the same time, we have to fight against the disease as just a real health maintenance. So we have to do the two things together. We have to predict and we have to anticipate. We have to tackle with the uncertainties you mentioned. But we don't need to exaggerate the potential possibilities. For example, we are almost sure that there's no readily human-to-human transmission among the current H7N9, which was not confirmed, but which is almost predictable. Dr. Gao rightly mentioned that because the live food market was likely the source of the infection, they decided to close the market. But they did not restrict travel or trade in between China and other nations because it is not likely that will affect the spread of the diseases based on the current knowledge. So these kind of so-called grayish knowledge, we have to be very realistic. the tackling against infectious diseases is always a trade-off. Trade-off between the risk of infection and our comfort level of life and the trade and the other kind of activities.
Because it's almost impossible to isolate one country from the rest of the world.
Yeah, you can't isolate China as a continent from the other nations unless it is really deadly virus spreading all over the nations, which is not happening right now. So we have to acknowledge that there's always a gray zone, or there's always uncertainties, but always at the same time we have to be very realistic in tackling against this kind of new agents, which will continue to occur in the future.
And very briefly, you know, Japan has made H7N9 bird flu virus the designated infectious disease as of May the 6th. What sort of coordination becomes vital at the international level, do you think?
Well, this kind of law may not affect the international coordination necessarily. We have to point out that the flexibility applies to individual patients as well. We know that this H7N9 can cause a deadly disease, but at the same time, we know that some people got infected without any symptoms at all. So the virus might be the same, but the patients are different. So we have to treat each patient differently. For the extreme cases, we have to apply this kind of infection law to contain the virus so that we can protect others. But at the same time, we don't have to go that extreme to violate the human right to hospitalize people unnecessarily. So we have to balance out all the time, depending on the patient's situation.
And I believe it's almost impossible to decrease the risk level to absolute zero.
Oh, you don't look into that. If you look into the risk zero, that is completely unrealistic.
I see. So perhaps you've talked about the trade-off. We could also think about the balance of not sounding perhaps too alarming, but always be alert as to what risks there are out there.
Yeah, I think we have to look at the things what we can see directly and not to over-exaggerate or not to underestimate the risk. That is the best way to tackle against these kind of emerging infectious diseases.
Thank you very much. Well, unfortunately, that's all the time we have today. Thank you, Dr. Gao, Mr. O'Leary, and Dr. Iwata for joining us today.
Thank you.
Now, many scientists are concerned about the possibility of a pandemic. What form will the next new virus strain take, and what sort of threat will it pose? Our response will need to be quick and global. But that's it for this week's edition of Asian Voices. Thank you for watching and see you again next time.